Hi, everybody. My name is Marty Guthmiller. I am the CEO at Orange City Area Health System, bringing to you today the 44th edition of the COVID-19 Community Briefing. I looked back in my records a little bit today. We've gone through April, May, June, July, and for those of you that haven't figured it out yet, we're in August. Here we go with another month. As it is a Monday, I am going to give the local scoreboard. Nothing earth-shattering in the local scoreboard at all. We have had 76 positives at Orange City Area Health System in the 1,287 tests that we've done. That is a positive rate of 5.9%. So a pretty good rate, 5.9%. I'm going to jump right now to the Sioux County, and I'm going to explain again some verbiage a little bit that I want to make sure. In Sioux County, we've had 593, so almost 600, 593 positives of the 4,052 tested. I decided to talk about tested instead of tests. Because that's the way that the state records them. And I'm pretty sure that that means tests, but they report it as tested. And so I am going to report it that way, the same as what it is on the coronavirus.iowa.gov site. So in Sioux County, then the rate is 14.6%, which is on the decline. The last time we talked, it was 14.8. The time before that, 15.2 or 15.0, then 15.2, and then 15.5. So we are on the decline, not steeply, but rather consistently. So that's very good. Region 3, the 20 counties in Northwest Iowa, 25 hospitalized in those 20 counties. Last time we talked, that was 23. We have 5 patients in 20 counties in the ICU. That number previously was 6. And we've had 4 admits in the last 24 hours in Region 3. In Iowa, we've had 45,782 positives of the 488,138 tested. That rate is 9.4%. And that has gone up a little bit from 9.3 to 9.4. But again, the tested number on the website, it does say that 1 out of 6 Iowans have been tested. My guess is that that's probably 488,000 tests, but not 488,000 Iowans. We're starting to second guess everything these days, but I want to report exactly what's on the website, and the word tested, T-E-S-T-E-D, is what they report, and that's what I will continue to report. Hospitalizations in the state of Iowa, they have gone down from 225 to 206 today, so that is in the right direction. Still a higher number than we'd like to see, but nonetheless heading in the right direction. In the immediate area here, Sioux County is at 0, Plymouth 1, Lyon 1, Osceola 0, O'Brien 1, Dickinson 2, Clay 0, Beebe 0, Woodbury went up 1 to 11, and Polk County dropped 7 to 38. There are still 5 counties in the state of Iowa with 10 or more hospitalizations. That is the same number as previous. Moving on to deaths, we have had 878 COVID-related deaths in the state of Iowa. That is 23 more than on July 30th. It is trending down. After trending up beginning in mid-July through late July, it is trending down now. and the curve is beginning to bend in the right way. So that's a good thing. Every death is tragic, and I'm not trying to downplay that at all, but it is trending correctly. I'm going to break these down a little bit, again, maybe give you a little bit more information. We know that in Sioux County, we've had 2 deaths attributed to COVID, at least COVID related. Of the 878 deaths in the state of Iowa, 610 of those are known pre-existing conditions. There are, I don't know, a couple hundred more that the pre-existing condition is unknown, but 610 of the 878 known pre-existing conditions. I think it's also really important to re-emphasize the fact that so far, Lord willing, this will continue, but in the state of Iowa, we've had 0 deaths in the under 18 age category. 2% of the deaths have occurred in the 18 to 40 age category, 2. 10% has occurred in the 41 to 60 category. 40% in the 61 to 80, and 48% in the above 80 age category. So when you look at the 2 upper age categories, 61 and above, we have 88% of the deaths in the state of Iowa. So that continues to be by far the most at-risk population, if you will. Don't want to dwell on that, but I thought it's important, again, particularly when we think about school, to keep all of these discussions in context. Just testing positive for the disease is maybe not the worst thing in the world, because most people are not getting very sick or not getting sick at all. A lot of these positives have been asymptomatic, so people aren't even showing signs. If these positives are reflecting those kinds of situations, it's not really that big a deal. We don't want to minimize, though, the potential for serious disease. But when you look at the death ratio here and the death structure, I think that helps keep things in perspective a little bit. I would like to talk just briefly as an update to Prairie Ridge and its outbreak status. I'm going to talk about that a little bit. Again, not that I'm disagreeing, because it does fit the definition, but I want to keep that in perspective for you. First of all, once outbreak status is declared, and that is declared when you have 3 or more residents within a 14-day period of time, within a 14-day window. We had 4, and I'm gonna break that down for you. But you will remain in outbreak status until 14 days passes from the last time that you've had a positive. And so we remain in outbreak status technically. We've disclosed, and so it's not new news, that there was a COVID-related death here at the hospital that was attributed to Prairie Ridge, but the patient was not admitted with a COVID-related situation. And so that was one of the 4. A second one of the 4 has since been determined to be a false positive. We informed the state of our thought that maybe it was a false positive originally, but there was a positive rapid test, then there was a negative PCR test, then there was another positive. I'm sorry, I'm going to start over. There was a positive rapid test, then there was a negative PCR test, then there was another negative rapid test, and another negative PCR test. So we've had 2 2 negative PCRs and 1 negative rapid versus the original rapid positive. So it was a false positive. That doesn't matter to the state, but that takes our 4 down to 3. And like I mentioned with the patient who was in the hospital, that really means that there was 2 out at Prairie Ridge. And so let's all keep this outbreak status fenced in a little bit. We're very open about it. We're doing everything we possibly can. Our patients at Prairie Ridge, our residents at Prairie Ridge are in a negative pressure suite, which is far more than is required in a nursing home environment. We've used ultraviolet disinfecting light out there. And so we're doing everything possible. It doesn't make it any less tough on seniors. And so we're very cognizant of that. But the truth of the matter is we can't move out of this phase until we go through 14 days. You just can't. So we're in phase 1 for 14 days. Nothing happens during that time. We'll go another 14, go to phase 2, phase 3, that kind of thing. And so I just wanted to give you a little bit more background with that. We do feel like things are definitely under control, and we're hanging in there as best we can. Just a quick mention also on IgG testing. We have moved our IgG testing, or the antibody testing, or the serology testing, it's all the same thing, to our occupational health department, which is on the west end of our building. Some of you would view it as the physical therapy entrance. It's in Medical Building 1 on the far end, west end of our building. Same hours, noon to 4. You can come in whenever you want, have your IgG tested. We moved it from the walk-in clinic because basically we were having one person come. There was an initial interest, and after a couple weeks, that has waned. And so we're still offering the test. If you'd like it, you can have it, but it is at our OC Health office here on our main campus. That's it for today. I still ask that you control what you can control. Use common sense out there. Keep things in perspective. Wear your mask at all, if at all in doubt. Keep your social distancing. Stay strong, stay vigilant, and above all else, stay healthy. Thank you again for joining us today.